First, I unmute and thank you, Hattie, for that introduction. Um, let's see here, just do my screen share, do all the pieces that I have to, and now I'll do my slideshow. And here we go. All right. Well, I have to say it was the shortest travel I ever had to make to Kansas from Minnesota. So thank you for having me. I presented to the Minnesota Narrow earlier this year, and I guess that's how I got the invitation to come to Kansas virtually. So stress management and workplace challenges, leaving work at work. And this year with COVID-19, it's especially important that we remember all of the things that we can do to keep our home life separate from our work life and reduce stress. Here's about me, happy in my cap and gown. You can download the slides to this on the portal for this conference. You can look back and I'm not going to be reading any of these slides word by word, so you might want to download these and have them to refer to later. Here's just a brief bio about me. I'm a licensed alcohol and drug counselor in addition to my being a licensed professional clinical counselor, and I have practiced as a private practitioner as well as crisis counselor, research therapist, and I worked in a local prison in Minnesota. So I have some experience in working with anxiety, with stress, with trauma, with people who aren't living their best lives or people who are trying to live their best lives. Just here's a small print. No agencies or for-profit organizations are paying me to say anything. Information is not designed to diagnose or treat serious mental health conditions. If you or anyone you know is feeling unsafe or has the desire to hurt themselves or others, call 911 immediately. And in the interest of time, you can type in your questions in the chat box and we'll address them at the end. Today's outline, basically, what is anxiety? What is stress? What are the effects of stress? How can I cope with stress? And how can I change my stress response? And just letting you know, we know so much now about neuroscience and how the brain works that yes, we can change our stress response and become a more calm and effective human being. And we'll start by looking at some pretty flowers. Isn't that nice? So what is anxiety? It's understood to be both a genetic and environmental effect on the body, both nature and nurture. And it's a whole mess of different symptoms that happen because our brain is, dealing with challenges. And so it makes hormones and neurotransmitters that cause those stress responses in our body. So from the Diagnostic and Statistical Manual of Mental Health Disorders, I'm just going to read generalized anxiety disorder, constant and intense feeling of anxiety regarding anything. Sounds bad, and it is. People with GAD struggle to control their worries. They tend to anticipate some sort of disaster despite lack of evidence. So that's the basic understanding of what is anxiety. And then I'm going to just scroll through some of the more specific forms that generalized anxiety disorder can also take. So there's social anxiety disorder, panic disorder, agoraphobia, which is not fear of heights, it's actually fear of open spaces or being in a crowd. Obsessive compulsive disorder is an anxiety disorder, as is post-traumatic stress disorder. There's also those specific phobias like arachnophobia, fear of spiders, separation anxiety disorder, which often shows up in infants and young children, and then an illness anxiety disorder, which people have heard of, is called hypochondria. And if you have any of these or have a client who's experiencing any of these on an ongoing basis, they may have an anxiety disorder, and it would be helpful for them to visit with a mental health professional for accurate diagnoses and treatment of that condition. So now we're going to step away from the clinical anxiety conversation and move into a more generalized discussion of what is stress. So stress is how our bodies respond to a direct threat. It's a very natural response mechanism, and the stresses can either be real or perceived. Even change is considered a threat by our brains. The very middle of our brains, the amygdala, that's where all that fear is stored. So a little bit of humor to lighten the mood. Late into the hike, I discover a fatal design flaw. My hand knit onesie lacked a back door. Okay, laughter is a good thing to take care of stress. So what are some of the real or perceived threats that we've been going through under COVID-19? Of course, fear of infection, there's the working from home stress, no alone time with the family around 24/7. Whatever's on the news is always stressful. Concerns about the economy or losing our jobs, not having enough money to pay bills, virtual visits, and maybe coping with those stressors by spending too much time playing music, playing games, or watching news online. Additionally, it's constant updates. How many people are sick? How many people are dying? Even going to the grocery store can be a stressor because we have to mask up and stay 6 feet away. Social media is people who are responding to this fear, this stress. Our bored children can also be a stress to us, as well as family conflict that comes out more now than ever before, because what else do people have to do but to ruminate about what they're unhappy about? Cooking 24/7 can also be a stressor, and as can boredom, cabin fever, and maybe even obsession to keep the house in order. Also, too much mess, clutter, and chaos causes stress. So here's some of the physiological descriptions of what causes stress. The first one is the adrenaline system. So you see by this picture that stress, either physical, psychological, or environmental, is perceived by the brain, the hypothalamus, and then that triggers the pituitary gland, which isn't just in charge of growth, which then goes through, stimulates the production of ACTH, which then creates cortisol, which is the stress hormone. Cortisol also makes us fat. So if you wonder where those pandemic pounds have come from, now you know. Another area of natural stress response in the body is the amygdala. And this makes the stress hormone cortisol also. So you have the location is deep within the temporal lobe, and this automatically responds to anything that makes it think that you're under attack. So if you see a stick when you're walking along the path and out of the corner of your eye, it looks like a snake, your brain will respond as if you have just seen a snake. So it's helpful for staying alive in prehistoric days. Now in modern times, maybe not so much. So what causes stress? There are the real dangers, people breaking in your house, things that are causing, sickness and illness. We respond with the FFF, flight, fright, or freeze. So like the bunnies, just freeze. Or there's the fight or flight that we're used to. There's the perceived dangers. Things changing around in our environment causes stress, like tornado warnings or, the smell of smoke. I don't know if you were getting the smoke plumes across Kansas from the wildfires out west, but we were in Minnesota, and I noticed when I step out, the sun is orange, the sky is gray, and there's this smell of smoke that just kind of put the hairs on my neck on end. Also, if we get stung by a bee, we can have an adrenaline response. Arguments, misunderstandings, getting stuck in the future or in the past, conflict, all of these things cause stress in our bodies. So during the fight, flight, or freeze stress response, the things that you might recognize experiencing include racing thoughts, your vision changes to a tunnel vision, maybe dry mouth, faster heartbeat, sweating, shallow breathing, and tense muscles. And all of these have physiological grounding in our evolution. It's fascinating, isn't it? So there are both positive and negative effects of stress. And then each individual has their own stress tolerance levels. So as you see in this chart, some people get really energized when they're under stress. And so these are the people who love working on deadline and should probably be in a newsroom somewhere. Then there's people who feel a little bit motivated. So, you know, they leave their projects till the day before, and that way they're more motivated to do them. Then there's the people who get overwhelmed by stress, and they're the ones who should probably plan far in advance when they have deadlines to keep themselves from getting overloaded and possibly move into the paralyzed area, which is, you know, basically it's way too much, I can't deal with it, so I shut down. So this little graphic here is kind of hard to read, but basically it shows the areas of the body that are affected by the fight or flight response. And you notice just about every place in the body is affected. So our brain sends out chemicals, hormones, our vision changes, our hearing becomes more acute, our mouth becomes dry because our digestive system shuts down to send more energy to our heart and lungs, which are going to increase in you know, the aim of running away. Our muscles get stronger because, again, more of our energy gets sent there. So stress affects every area of our body. Short term, we can have back and neck pain, chest pain, other types of muscle pains, nausea, shaking, numbness, or tingling. You might notice that if you, like, you know, your child almost falls out of a window and you grab them and you bring them indoors and you feel sick to your stomach and you're shaking all over. And that's a stress response, and that's the short-term physiological symptoms. Now, the problem is if we start experiencing stress for a long-term, you know, period of time, you know, we get these headaches, dizziness, irritability, and anger, which really affects our relationships. We can grind our teeth and have jaw tension, which can result in temporal mandibular joint syndrome. We end up with insomnia, which weakens our immune system. We could get asthma because our breathing is no longer free and unrestricted, ulcers in our gut, nervousness, paranoia, situational anxiety, and depression. That can also result in decreased sex drive and other types of muscle tension. So these are not happy, joy types of things to go through. Now, if we spend years under long-term stress, like if somebody is like the president or CEO of a major corporation, that's why we end up seeing some of these things. We see hypertension, strokes, heart disease, diabetes, weight gain, chronic fatigue, alcohol and drug use, as in addition to suicide. It says here that American Medical Association notes that stress is the basis of more than 60% of human illness and disease, which is really a mind-blowing statistic. So chronic stress can also lead to situational or acquired major depressive disorder and other anxiety disorders. And, you know, this is a reason for concern because sometimes we deal with clients who just seem to be perpetually depressed or perpetually anxious. And it's not surprising considering where they may be living or what type of situation they're dealing with. If they're low income, maybe they're not getting enough food. If they're stressed out about not being able to find a job that matches their abilities, they're stressed out about not having money for their medications, people who live in abusive relationships. So you can see that a person's life consequences or life situations can also contribute to mental health disorders. It's not just that you're born with them, you can also acquire them. So earlier this year, the big news was Minnesota's climbing raccoon of 2020 went up a side of one of our buildings, and he says, I reached the top and now I'm reaching out my paw to help you up. Plus, I know all the words to God Bless America. Okay, a little stress relief there. Stress symptoms and solutions. We know that if we are stressed out in one area of our life, that sometimes that stress is going to spill over into other areas of our life. We call it the kick the dog effect. So if boss yells at dad at work, dad comes home and yells at Junior, and Junior goes into the other room and kicks the dog, and the dog's like, what'd I do? Also, it's good to know that, you know, our mind and our body are not separate parts. The mind body connection is real. We are one being. So our thoughts, our feelings, our physiological experiences of the world, that's one set of life. So we're whole beings with strengths and weaknesses. And we also know that when we improve one area of our lives, that other areas of our lives also tend to improve. So what we're finding is that people who work on improving themselves and improving their own growth and development become more resilient to stress and tend to bounce back more quickly. Um, Research into the brains show that we have what's called plasticity. So if one part of the brain becomes damaged, either an accident, a traumatic brain injury, or stroke, that the brain can create another like hearing center or vision center with enough time and training. So, you know, what we do know is the change takes time. And one of my favorite reminders is that it takes 3 weeks to make or break a habit. So if you stick with something at least that long, you're liable to see change happen. There's a lot of areas that we can experience stress, and I'm just going to run through some of those now. Cognitive stress is things that happen inside of our head. And so when we're under stress, we're going to experience this list of various things that are causing us difficulties. So we have stress that results in, you know, confusion, heightened or lowered alertness, perfectionism, self-doubt. All of these things are symptoms of cognitive stress. Now, in order to gain resilience in our thinking, we need to identify, are we an overthinker or worrier? And if we are, there's things that we can change. We can start focusing on the positive aspects of ourselves or our environment. We can also repeat, you know, like a mantra. Mantra in Indian means mind protection. Meditation is actually shown to reduce stress in the brain, as is mindfulness, which is living in the present. Also, spending time outdoors, connecting with nature has been shown to reduce stress in our minds. We also can experience emotional stress, and the symptoms of that include, you know, emotions out of control, helplessness, depression, denial, panic, even, you know, going overboard with our own emotional expression. Emotional stress is a real thing. Now, what do we do about it? So here's a list of 10 essential traits of emotional health. And his website down there, journeytorovery.com, talks a lot more about this and includes staying honest, staying peaceful, staying grateful, staying positive. So all of these things can help us to manage emotional stress and to gain resilience in our emotional dimensions. Behavioral stress. Behavior is how we act out. So we can become impatient, irritable, have nightmares, find that we're, you know, more accident prone because we're not staying, you know, present in the moment, having an elevated startle response. All of these can lead to further stress because when we're behaviorally stressed out or having behavioral stressors, we tend to affect other people who then respond in their own way, and we start just stomping on each other's toes all over. So to develop behavioral stress resilience, we recognize that anytime we are impatient or irritable or hypervigilant or moody, that's a signal that our internal compass is a little off balance, and that maybe we need to become more self-aware about how our acting out is affecting other people. One way to become more self-aware is to start journaling about our emotions. Creating goals and making plans to achieve them also can help us restore balance, because when we check something off the to-do list, it gives us a little burst of dopamine, which is that feel-good neurotransmitter, and it helps us calm down a little bit. Another thing that's important is maintaining appropriate boundaries with clients, and not taking home clients' problems with us. Additional ways that we can increase resilience in our behavioral domains is to use constructive self-talk. And one example of that, it's good to separate myself from other people's problems, especially at work. Let's see, reaching out to coworkers or a counselor about your emotions and maybe your reactions to those things. Not over identifying with our clients' frustration, anger, anguish, and hopelessness, because then we can lose perspective and maybe not be able to provide the professional assistance that we need to. Spiritual stress can result in us questioning the meaning of life, feeling angry at God, become skeptical about our faith or religion, feeling a loss of purpose or even less self-satisfaction. And different ways that we can increase our resilience on the spiritual domain is reconnecting to the church. More and more churches are having online services, and even parking lot church is becoming a big thing. If you lack any sort of spiritual practice in your life, there's lots of quotes on Pinterest, there's videos on YouTube that you can, have going on in the background just to keep yourself focused on that there's more to life than just, what's in front of us. That, maybe we need to think about the things that we are grateful for, the things that actually make our life good on a spiritual level. Walking in nature and admiring the beauty of the world around us as the colors start to change, as the asters are blooming in the forests. We can also listen to meditation music and even focus on feeling connected to the living things that are in our bioregion. Interpersonal stress is another biggie. The symptoms of interpersonal stress include withdrawing from our friends and family, a decreased interest in intimacy or sex, projecting anger or blame on other people, feeling intolerant or lonely, or having more conflict with the ones we love. To develop resilience to those symptoms of interpersonal stress, part of it is just understanding that we are in a really, really stressful time right now with, the virus and the economy and all of the, the stuff that's on TV. It's really, everything is really highly elevated. So we are going to be more stressful. So giving each other a little bit of slack, saying, hey, we're all under stress. One way to do that is to practice detaching from the events that are happening around us. A lot of us were really highly affected by 9/11, and I know some people had to turn off the television because they were just glued to the screen, like watching the footage of the planes and the people falling out of buildings just over and over again, and they were traumatizing themselves, and then that made it difficult for them to have positive interactions with their families. One phrase that's really easy to say but hard to practice is take nothing personally. Oftentimes when people are around us are cranky or stressed out, it's about them, it's not about us. And so if we take other people's moods less personally, then we won't get, cranky and snappy at our friends. Another thing to do is to monitor our self-talk. What does my internal dialogue look like? Am I critical or judgmental, or am I understanding and caring? That's going to affect how I feel inside and how I respond to stressors around me. Then we've got the physical stress. We've all been dealing with maybe working from home, and maybe our desk at home isn't set up in the most ergonomically correct way. And this can result in, us having challenging, like muscle tension. If we're under physical stress, we might notice that we're sweating more, or that we have a more rapid heartbeat. We're feeling muscle tremors. If we learn about a loved one who's gotten the virus, or somebody who is in hospice, we're going to start noticing that we have these physical stress symptoms going on in our body, and we might wonder, oh no, what's going on? And I know many people have gone to the doctor with these symptoms, and they said, yeah, you're stressed out. You need to work on minimizing your stress. Well, here's how to start. Pay attention to your breathing. We can take deep and even breaths and actually manage our stress and reduce it. If we walk or exercise on a daily basis for a minimum of 10 minutes, we can start, our brain starts producing endorphins, which are a positive brain chemical that helps reduce stress and increase our physical resilience. If you look up online, progressive muscle relaxation therapy or technique, you can learn to train your body to fully relax and let go of that, that muscle memory of hanging on for dear life. Drinking water also helps reduce stress, as does eating healthy, practicing sleep hygiene, limiting alcohol, caffeine, and nicotine, and watching funny videos that make you laugh. Then there's these other non-physical type stress symptoms that you might notice yourself doing, bursting out in tears without knowing why, feeling emotionally fatigued, like if one more person asks you for help, that you're going to lose it. Having trouble concentrating, having problems remembering things. These are all symptoms that you are experiencing stress. So there's multiple different effective coping strategies. We can work on in the moment, short-term relief, which is, they call that triage. And then we can start creating long-term life practices. And over here on the right side of the screen, we have a yoga dog saying, remember, this is now and now and now. Live it, feel it. Next, so some of the in the moment strategies. One thing that a lot of people use is called distraction. And that's useful in the moment, but it tends to be counterproductive if you use it as your only coping strategy, because you could spend your whole day playing solitaire on the computer. People like to listen to music, and generally music that doesn't have words in it is better for relaxing to, because then the mind doesn't grab onto the words and start, playing around with meaning and all that. Music activates both sides of the brain and reduces stress. Other things we could do include coloring, taking a walk. Every hour, get out of your desk for 5 minutes and do some stretching. Sometimes we need to learn to practice radical acceptance, which means no matter what's going on, I'm going to be okay with it. If it's not going to actually kill me, then I can accept it. Sometimes we need to write down 3 positive things that are going on in our lives, or 5 things that we're grateful for. These actually have scientific basis in research that show that, yeah, this stuff helps. Now, long-term stress management includes creating new practices that help us maintain a level of calm on an even keel throughout the day. And the one technique that I like to teach is called slow-paced, deep diaphragmatic breathing. Now, the picture that you're looking at is from below looking up to a person's chin. And you can see in there's like this little nervelings that are spiraling around in that person's rib cage. And that is a medically accurate illustration of the vagus nerve. So before we step into the vagus nerve, how fast should we be breathing? So if we're stress breathing or running a marathon, we're probably breathing once per second. That's really fast, by the way. Normal breathing is 20 to 40 breaths per minute. And when we are relaxed, we're breathing 6 to 10 breaths per minute. Now that sounds really slow, but if you do it slowly and intentionally, you will have positive effects on your well-being. So the vagus nerve, what is it anyway? Vagus means wandering in Latin, and this nerve that's illustrated over on the left-hand side is one nerve that goes up your spine and then branches off to all of the major organ systems in the body. The vagus nerve is, as the bottom sentence says, the prime driving force of our parasympathetic nervous system, which regulates our rest and digest or tend and befriend responses. And both of those are opposite of the fight, flight, and freeze response. So what happens is when we use deep, slow-paced, deep diaphragmatic breathing, we actually are triggering or stimulating that vagus nerve. So we start by filling our lungs from your belly. And then you hold your breath for a long 1,000, 2, 1,000. And then you exhale by pulling the belly in. And what you're doing is that diaphragm, that's the muscle under your lungs. Again, that's stimulating the vagus nerve. And if you do this for 10 times minimum, the vagus nerve will go up, goes up and sends a signal to the brain, and it says, oh, look, we're breathing 6 to 10 breaths a minute. That means we're relaxed now. So, hey, brain, make some dopamine and we'll relax. And it's really awesome. I work with clients who have anxiety from, PTSD, from car accidents, from growing up in abusive families, from people who are trying to, change their lives around and stop using chemicals. All of them are practicing slow-paced, deep diaphragmatic breathing and are, 1 week at a time, learning how to manage their anxiety and teach their bodies and brains how to work together to stay calm on a even keel. This is one of my favorite cartoons. The dog saying, hey, watch what I can make Pavlov do. As soon as I drool, he'll smile and write in his little book. So Pavlov's dog Pavlov was a Russian scientist or a Russian psychologist, and he figured out that his dog drooled when he mixed up his food. So what he did was he discovered, quote unquote, that he could do operant conditioning by ringing a bell at the same time that he was mixing up the dog's food. He conditioned the dog to link together the sound of the bell and his salivary response. And then Pavlov tried just ringing the bell after a couple of weeks of this, and the dog salivated when Pavlov just rang his bell. The reason I'm telling you this is you can do that too with your own dopamine responses from the brain, with your vagus nerve stimulation, with your diaphragm. You can learn how to manage your stress. Now then, we need to find a way to balance out our work and our life. Now, we know that work-life imbalance has been around since at least the Industrial Revolution. I personally wasn't alive then, but I've read about it, and I stayed at a Holiday Inn Express last night. No, I didn't. We can carry stress home from work or from our workplace at home, and this affects both our work life and our home life. Boundaries become blurred. We lose track of the start and the end of the workday. Sometimes home and family takes the back seat as the stresses from work carry into our home. Sometimes we obsess about focusing on work because that's like the only thing in the world right now that can be managed or controlled. And then that has, bad effects on our family, because it can result in behavior problems with kids or relationship static with our loved ones. So we're going to see in our bodies and our other areas of our life that there are warning signs if we have work and life imbalances that show up in our body, our mind, our emotions, and our behaviors. Some of this we already listed. And it's, being aware of what's happening to us is our job. We can't count on our loved ones to say, hey, I think you have a work-life imbalance and you're experiencing loss of confidence, irritability, depression, apathy, apprehension, alienation, and anxiety. You should get help. I think we need to watch ourselves and become our own diagnostician. So again, we've got these concerns about what's going on in our lives. And, it can be a real big deal. So what do we do? Well, Happy Cat has run out of happy. So he's looking for help too. What do we have to do? We reduce the additional accumulation of stress from our daily lives. So I don't know about you, but some people will hold on to a frustration and chew on it for days at a time. Okay, that's got to stop. If we're frustrated in the moment, we either need to take a walk and go yell at the woods, or we need to say, I'm really frustrated the way that you said that to me because it makes me feel like you don't value my work. Okay, just saying something as simple as that, being real, actually helps reduce stress. So another part of being real is letting yourself cry when you're sad, or laugh when you're happy, or find beauty around you. A challenge, and this is the long-term solution, find a way to live according to your values in each moment. And we need to start by, how do we love ourselves? How do we take care of ourselves? How do we learn to cooperate with our family? How do we start to approach our problems with curiosity rather than blame? And part of it is watching our own bobber, staying in our own lane, letting coworkers solve their own issues. We don't need to fix everybody, just our clients and ourselves. Become aware of our feelings when we start feeling stressed, and notice, okay, this is what I feel when I'm stressed. Maybe I should go drink some water and take a walk around the building. And again, that 5-minute break every hour, very important. Water, humor, meditation. They say if you, in order to improve your relaxed state and calmness, you need to sit in meditation for a minimum of 5 minutes a day. And if you don't have time, you need to sit in 30 minutes of meditation. That's a joke. Forgive yourself and others. Move your thoughts away from thoughts of the past or the future. The only thing we have any control over is now. Declutter your house one little corner at a time. Wear comfortable clothes. Tell your family that you love them. And here's another list of 12 steps to self-care. I'll just read a few off of them. If it feels wrong, don't do it. Trust your instincts. Be kind to yourself. Avoid drama. So you've heard me mention mindfulness, and a lot of people say, oh, that's just part of that yoga, hippy dippy shit from, no, it's actually now been proven by science. Mindfulness is a practice that helps us increase our awareness in the moment and reduce the chaos between our ears. Mindfulness is thinking less, but becoming more aware. And there's a variety of mindfulness techniques that are helping people with and without mental health disorders to improve their thinking and their relationships. One of these techniques is called distress tolerance. Distress tolerance is not letting yourself get wrapped around the axle because something isn't going the way you want it to. It's actually observing the thing that is causing distress, saying, look at that, I'm feeling distressed. And asking the question, can I do anything about it? If the answer is no, then you just have to tolerate this distress. Say, all right, I'm just going to accept that this is out of my control, and I'm going to move on to the next thing. And just being able to do that allows so much reduction of stress that you'd be surprised. So the Buddha is purported to have said, all that we are is the result of what we have thought. The mind is everything. What we think, we become. And the bunny says, I have no idea what you're talking about, so I'm going to put a pancake on my head. So here's some more ideas. Again, you can't read it very well, but on the bottom you can see there's a website. You can look at the slides that you download off the portal and print this out. This is very helpful to share with clients. It's also helpful to put up at your own desk. Acute stress management, the stressors that happen in the moment, like, you know, having to sit on the telephone with the insurance company for 4.5 hours. Your wait time is 72 days. And then there's the chronic stress responses. How have I always reacted to not getting my way? How have I always reacted to not being able to get through on the phone? So when we start to become aware of our ongoing or short-term stressors and our malfunctioning responses, we can actually start claiming some victory over letting ourselves being stressed. And here's some more that you can print out for yourself or your clients. The web address for that is somewhere on here, or you can just print it out from the PDFs of the presentation. Another thing that's important in identifying some of our old patterns of behavior is called cognitive distortions. We all have grown up with different ideas about how things should or shouldn't be. Not all of those things that we learned are accurate. And I'm just going to run through some of these. They're shortcuts to actually thinking things through, and these shortcuts can cause us more trouble than solving. So, like example, making a mountain out of a molehill. Everyone's heard of that one. That is a cognitive distortion. If our first, out the door knee-jerk reaction is to say, oh man, that's impossible, I could never do that, that's making a mountain out of a molehill. It might also be categorized as all or nothing thinking. Sometimes we overgeneralize. Oh man, I didn't get through on the phone for the tickets, and I'll never get those tickets. Mental filters, always thinking about the negatives, never thinking about the positive. Are you a glass half full or an empty glass person? We tend to, if we're, caught in our cognitive distortions, we sometimes discount the positive. We jump to conclusions. We'll hear 2 words out of somebody's mouth and we'll already have figured out the end of their sentence. And so we're going to operate on what we think they're going to say versus what they actually say. Magnification or minimization. We can either blow things way out of proportion, or we minimize them to where, oh, well, that person said that they were out of money, and everyone's out of money. So what's the big deal? Well, yeah, that individual actually, because they're out of money, are going to suffer XYZ. Then we emotional reason rather than saying, these are the facts here versus this is what I feel the facts are. Sometimes we should on ourselves, and using the word should is, it's a not so gentle way of putting ourselves down. Well, I should have done this, I should have that. And I tell my clients, don't should on me or you, because, it starts to stink. Labeling is also another shortcut. And, in our mental health field, we say, a person isn't autistic. They are a person with autism. And I don't talk about the schizophrenic man. I talk about the man with schizophrenia, because it's person first. It's not a disorder. So if I care about the person first, I'm going to treat them as a person rather than a mental illness. And that also helps us to feel like, we're being careful about our words, and the other person feels respected as a human being. And sometimes we blame ourselves for things that happen. Oh man, if I hadn't turned on the television, my favorite team wouldn't have lost the game. Well, obviously that's not accurate, but there might be other ways that we use personalization and blame, and it's actually a cognitive distortion. Avoiding your triggers isn't healing. Healing happens when you're triggered and you're able to move through the pain, through the pattern and through the story and walk your way to a different ending. So how do we stop bringing stress home from the home office? So in addition to setting firm boundaries around office time and home time, radical self-awareness is what's called for. We have to recognize how we're being affected by our clients, by our work, by our coworkers. And sometimes we feel like, this is just too much. I can't deal with it. Or we put up these big walls and say, I don't care what everybody's feeling. And then we become the cold, cruel, and uncaring, uh, person that's, saying yes and no and rubber stamping things. So what we do is we start taking the observer role inside our own head. And this is an alternative to the fixer role or to the judge role. When we're observing ourselves, when we're observing our responses, that keeps us from making, superficial, grandiose, or all-encompassing statements. And so if we say to someone, don't worry, everything's going to be okay, that's really condescending. And those type of superficial reassurances don't help you or the client. Don't offer to solve problems that you can't solve. That just leaves you feeling that, I'm failing people on a daily basis. Understand that anxiety and stress are normal physical reactions to uncertainty, and they're not going to cause harm if you practice ways to reduce their effects on you. And then we can, encourage ourselves, encourage our family, encourage our coworkers, encourage our clients that if they use positive coping skills, they can reduce the effects of stress on their lives. So leaving stress at work, how do we do that? Well, one way to do it is to flip the emotion. Instead of feeling anger, fear, or frustration, make a joke about the situation. Not, of course, an unkind joke, but something like, well, didn't see that one coming, did we? Just an example. Sometimes it helps to rate the stress response. So, on a scale of 0 to 10, with 0 being no stress at all and 10 being the end of the world is nigh, how much stress are you feeling right now? Okay, and how does that compare to last week? Okay, so you're feeling less stress today. What are you doing different today that is reducing your stress? Not being an enabler. Don't get roped in to somebody else's drama. Sometimes we can remember to speak to the individual, not to the stress. So I know you're feeling overwhelmed, but what did you do in other situations when you felt overwhelmed? Okay. And then when you see positive change happening, when you see improved stress responses, help others to manage their stress in the moment. So one thing to remember is that we are all complex organisms, and we have physical responses to the physical world. We have emotional responses to the emotional world. We have cognitive responses to everything, and spiritual responses to the things that inspire awe and love within us. If you ever need a stress break, just take a couple deep breaths, shake out your hands, shake out your shoulders, roll your head, and just rotate your shoulders back and forward. So we're getting close to the end where I'd like to take some questions, and I'm just going to wrap things up here. We know that stress is a natural response, and that too much stress can cause physical discomfort and illness. There's multiple areas in our life where stress can cause negative impacts and even burnout. We can take charge of our stress response. And one way to do that is by practicing radical empathy in our workplace and our home life. Empathy is the ability to understand another person's emotional perspective. And this leads to feeling accepted and validated and helps build trust, which leads to greater happiness. Now, feeling empathy does not mean you are taking on the other person's emotion. It means you can understand the other person's emotional perspective. You don't have to take it away. How do you do this? Be present, active listening, tune in to nonverbal communication, and practice pausing. We can't finish other people's sentences because we're not in their brains. Practice by counting to 5 when a person seems to be stopping. It's uncomfortable, but it works. Stop giving advice and instead be curious. Use the word we versus me. And we can improve our own emotional literacy, which helps us enhance our awareness and expand our own emotional vocabulary. So what do you see here? Is it just swirling colors? Or do you see those people standing there? So in reducing the stress in your life, remember to eat healthy. Take a walk, drink water, give yourself time out, clear your mind. And if you didn't succeed, or if you did, try it again tomorrow. I hope that you have found that there's some skills that you can use in your own life and helping others. Here's my email address, and if you have any questions about specifics, feel free to email me. I'll answer any questions to the best of my ability. And finally, and then it happens. One day you wake up and you're in this place. You're in this place where everything feels right. Your heart is calm, your soul is lit, your thoughts are positive, your vision is clear, you're at peace. At peace with where you've been, at peace with what you've been through, at peace with where you're headed. Namaste. All right, do we have questions?
It looks like we do have one question there. It says, this is from Megan. She says, a question about person's first language. I've heard recently that many people, specifically with autism or deafness, don't like person's first language due to implications that have autism is something that is wrong with them, as opposed to being a healthy, fully realized individual. Is that something you're seeing in your practice and research? I'm so sorry, some of those words are, can I read that in the chat? Oh, you're muted. I'm sorry.
Just got that. It sounds like you've got background noise that's causing an echo on your...
I do. I'm so sorry.
Right. Okay. So person first is as opposed to saying that schizophrenic guy or that autistic child or that, that slow woman. You know, we don't want to lead with a person's disability. We want to lead with the, Megan, that person who's here for help with her mental health. We want to talk about the person first. We don't want to talk about their illness first. So that's what I'm referring to. And if a person, is uncomfortable being identified by their mental health disorder, then absolutely, if they're speaking with people who are not familiar with the stigma associated with a mental illness, they can say, look, I don't appreciate it when you call me autistic. Even though I'm here for treatment of my autism, I'm actually a whole person that is here to learn coping skills. And so that's why, even in talking to, colleagues, I say, I'm meeting with my 2 o'clock person who is working on coping skills. And, there's no reason to say, working on their sensory issues because they have meltdowns at the grocery store. There's no reason to go into that. So I hope that was useful. Other questions?